Hello, my dear friends and colleagues. I want to say thank you for all your support and I want to give back. So, I would like to explain and show a few tools in the aligner software that we have because I think it massively speeds up the process of getting a case done. However, not everybody of us is using it. So, I hope this is helpful. A dear colleague from India was so kind to provide one of his cases that he's treating, and let's have a look at it together. So, I haven't looked at it before, completely new to me. The treatment goal is to reduce the overchat by premolar extraction. That's what he told me. I really like the visualization of roots in the Invisalign software. Okay, good. The question is, how do we design the digital treatment plan to make it predictable? And what do you think are the challenges here? So there are a few. The first challenge is the curve of Spee. So the extruded incisors. We need to intrude them. Otherwise, we will end up with heavy anterior contacts, which cause posterior open bite. Okay, another challenge is the bodily movement, since we're extracting premolars. And another challenge will be not to lose torque in incisors. Okay. So usually I would order my cases without any changes because I do the setup myself. There is a lot of constriction here. I wonder if we need all of this constriction, like narrowing the arch. Because what aligners are so good at is expanding, so why not use that? Yeah, and I mean, here we see that the molar will be facing will actually penetrate the lingual cortical plate, meaning that this movement is really hard. Probably we will not get 100% expression. But since the bone in the upper jaw and the tuberositas is so soft, so spongious, we probably get 100% of constriction of that molar. And then we easily end up in a crossbite. So, okay, that's how I do it. First of all, I will make all teeth unmovable. You probably need to fast forward at this point because it will take a time. Treatment plan and the diagnosis that the doctor has did. But probably there's a skeletal class 2 relation or skeletal class 2, the underlying problem. And we also have a dental class 2. Okay, good. So okay, just out of curiosity, why is this tooth looking so weird? Because another option would be to extract, that's not a good option. From biomechanic point of view, it's not the best option to extract this 7. It will make life difficult, but just thinking through everything. Okay, good. Now the 6 is in class 2, so I'm going to lock this position. Now I'm trying to get this canine to the right position. Okay, let's take care of the lower teeth because it irritates me to see them so much extruded. Good. So if we press Command, we can move several teeth at a time. Okay. To level the curve of speed properly, we also need to intrude lower premolars. Here again. Okay, that means we need really good anchorage here. So we're going to get rid of those attachments. Okay, so this is so annoying. I'm sorry, but the software really makes it very difficult to make modifications yourself. Good. Okay, so we need those attachments as a retention because when we want to intrude lower incisors, the aligner tends to lift off from the posterior teeth. This is why we need to have really good retention right here. We're going to do the same in the lower, in the contralateral side. Okay, this attachment is almost useless. It's so small. We need really retention. Okay, we're going to move this so it's not a problem with the button cutout. Okay, so here I want to have an as big attachment as possible. Yeah. Okay, good. So you can see there's quite amount of intrusion. And the intrusion is from the premolar to the premolar. Can you see that there's a slight distal movement? So this is not going to happen. Rather, because of the class 2 elastics, the teeth will move forward a little bit. So this distal movement is not going to happen. This is why we're going to delete it. And here as well. And if we don't take care of this, if we don't look at it, it might happen that in the software we have overchat, everything looks good, but in the mouth we won't have overchat, we have hard anterior contacts and then a posterior open bite. So this is when I say we make modifications to improve the clinical outcome, to reduce the treatment time, to reduce the amount of refinements. Okay, so that patient is a skeletal class 2. Premolar extraction is planned. Before I would commit to the extraction, I would ask the patient if there is any sort of sleep-related breathing disorder, because when the mandible is back, it's possible that the airway in the pharyngeal space is small, and that those patients have a hard time getting having good breathing during sleep. So this is why I would ask and evaluate breathing. I would ask the patient, do you snore? Do you sleep with your mouth open or closed? Can you breathe through your nose properly, especially during sleep? Because in the end, breathing is more important than the where the teeth are. Because when we cannot breathe properly, we don't get the restful sleep that we should get. So I'm going to lock those molars. I don't want them to move. Okay, and now I'm checking for rotations. Yes, okay, good. So I expanded the lower arch a little bit. And a very useful tool is the superimposition tool. So I want a little bit of expansion here, starting with the sixes. Because the smile width is also a crucial factor to improve the aesthetics of a smile. Okay, good. Now we're going to take care of the lingual root torque. Don't want to move the incisors out of the bone. That was incorrect. Okay, so I need to undo this movement because I want the roots to move. This is actually, I want lingual root torque. So don't expect 100% expression of this movement. This is why we can be a little bit more generous with this type of movement. And now I think we have some weird tipping, some weird angulations of the teeth. Here, that's what I want. So we need this tool here, other direction. So I'm just going to ignore the black and blue dots because we're going to take care this movement is going to happen, and there are a few tools we can use. First of all, attachments. Second would be bite ramps, but we can also do a squeeze exercise where the patient bites on something like a chewy to use the masticatory muscles to help with the intrusion. Okay, let's work on this side here. Okay. Looks like there's a little bit of a Bolton discrepancy. Let's go to tables, Bolton analysis. Mandibular access. Okay, from canine to canine, the access is not that significant, but over the whole arch, it's 1.6 millimeter access. So that's why I'm going to we can either do IPR in the lower, or we put the upper molar a little bit more in class 2. I rather go for a little bit more class 2 here, because we can always do IPR in the refinement. But if we do IPR in the first clean check, set. So I think in the multi-plane tool, there are just too many tools at once. It's hard to get the right one. My gosh, this takes forever. Usually 3 times as fast. Okay, looks normal again, but I'm still not happy here with the occlusion. So either I constrict the upper or I expand the lower. Let's see how much expansion I'm already doing. I'm doing more expansion here, so I'm going to equalize the amount of expansion on both sides, because then we have reciprocal movements, reciprocal forces, which is predictable because that's the law of physics. And that means we are increasing the predictability of the treatment plan, meaning that the simulation will actually look like the clinical outcome, or the clinical outcome will look like the simulation. Making sure all teeth are aligned. Okay, let's see. Still not happy. Still not happy. There is 0.6 millimeter buccal movement. Here's 1 millimeter buccal movement. So what else can I do to improve the occlusion? Here it looks good. Yeah, maybe another tip for you. A lot of people ask me about, do you look at the table of tooth movements? And the answer is simple: no, never, ever. because I cannot read numbers. What I can read is the superimposition. So the superimposition basically is the table of movements, just with colors. And it's like with one glance, you can see exactly the tooth movements that have been made. If you go to the table of tooth movements, I mean, it's like, doesn't tell me anything. So this is why I like to use the superimposition to evaluate the tooth movements. Okay. Good. So I'm quite happy with the setup. Probably will do some more adjustments, like looking at the smile arc. Yeah. Making sure that the incisal edges of maxillary teeth form a positive curvature. This tooth needs some resin bonding at the end to rebuild the mesial edge. Okay, good. Can you see here the embrasure is slightly bigger? That means that tooth is rotated, and we're going to derotate it so that the incisal embrasure is beautiful. Okay. That's a nice tool from Invisalign. I mean, that's more like what I'm used to with the Spark Approval software to see the roots. So it doesn't matter to actually see the anatomical root. What's important is to see the angulation of the tooth. Okay. Good. Good. I'm quite happy with the setup. Now we're going to look at the occlusion. Okay, now I'm going to get rid of the hard red contacts. Okay, that's really difficult here. Of course we can play around, but actually I would just see how it goes after the first set of aligners, and if there are some disturbing contacts, we can also take a burr and even the teeth a little bit out, because the shape of the second molars is very irregular, so it's very likely that we don't find a position where they fit perfectly. But what we can do is that we make sure this tooth doesn't get extruded, and there is some extrusion planned, so we're going to get rid of this. Great. Okay, good. now we take care of the attachments. So in the lower, we're fine. I also want to place attachments here on the canines to have retention for the intrusion of incisors. We have button cutouts for class 2 elastics, that's great. In the upper jaw, I would rather place a button cutout here instead of a precision cut, because the precision cut will be even more counterproductive to the bodily retraction. Or of course, like the incisors are proclined, so we want in some part we want a bodily retraction, but we also want to reduce the excessive proclination. But what we definitely don't want is to end up with retroinclined incisors. And by retraction, we will retroincline a lot, so we need to make sure we don't have too much features that will retroincline upper incisors. Okay, here, my dear colleague, I recommend to place a power hook, so or a power arm. Basically, that means you have a little arm coming out of the attachments, and I'm happy to provide pictures of how this looks like. Let's see if we can make it even bigger. Oh, beautiful. So we need to instruct the technician to keep the attachments on those teeth, even though this might cause manufacturing issues. Please keep attachments on upper second premolars and upper first molars, even if this causes manufacturing issues. So we will use this attachment for bodily movement, and to have more control over the root movement, we even will have a metal hook coming out of this attachment. So the hooks would be facing opposite sides, and then you insert an elastic chain between those hooks, and we do that to have the force vector closer to the center of resistance to ensure bodily movement rather than just crown tipping. I'm happy to go with this attachment here in the lateral. Here the same. We replace this with a button cutout, and here. So what you can actually do, what would be even smarter than having a button here, is having a power arm here and insert elastic from the power arm to the button. However, this can also cause some issues because the power arm might be in the vestibulum and causing some soft tissue inflammation. But that's just a tip to ensure more bodily movement of the canine. Okay, I think that's quite good. Now let's do a live update. And now we need to tell the technician how to stage the movements. This is the crucial part in improving the clinical outcome, because we need to think of the force systems and how much resistance does each tooth contribute to the tooth movement. So we're extracting premolars. That means we have reciprocal forces. However, it's different compared right side and left side, because On the right side, the molar is almost already in the perfect position, almost perfectly in class 2 with the lower molar. On the other side, the first molar is more in class 1, so it needs to come mesial a little bit. What I recommend to enhance the force systems, that in the first quadrant you keep the wisdom tooth and include it in the aligner. So you tell the technician, please provide upper right third molar, because this tooth will serve as anchorage. As we retract incisors in the first quadrant, this tooth will serve as anchor and avoid the 6 and the second premolar, 5 moving mesial, because they're actually supposed to move only 1 millimeter, not more. What else is important? Well, the challenging thing is the lower incisor intrusion. That's why we place so many attachments in the lower jaw. But if you see that the lower incisor intrusion is not tracking, and you will see that if the liners stop fitting in lower premolars and molars, then you tell the patient to do a squeeze exercise. So basically, they're supposed to bite on something. You can give them a chewy, but they put it between the front teeth, bite on it as hard as possible so that they engage the temporalis muscles. Hold it for 1 second, repeat it 60 times, and do 6 sets per day. So that will keep them busy. Good. Staging has been updated. Let's see. Okay. So we need to have some overcorrection of the torque here in the incisors. I'm evaluating if we have enough torque or if we should add more. So for now, I would go for that, but it might be that at the end you will want to add a little bit more torque, then you do a refinement and just add more lingual root torque to incisors. I used to use the procline and retrude pattern, the what's it called, retrocline pattern, where when you have retroinclined incisors, you would first procline at crowns and then do bodily retraction. Right now, I'm just doing lingual root torque right from the beginning. And that patient has a good length of crowns compared to roots, so the crowns are rather big, roots are not too long, so you can be confident that this will work out. So class 2 elastics, she should wear them I would go for heavy elastics 22 hours a day, because when you see, okay, you got more sagittal correction, you can always stop using them. I'm not, so right now I don't want to disclose any patient-related data, so I'm not going to look at the pictures, but I asked the treating doctor to have a look at the gingival phenotype of lower incisors. If it's a very, very thin phenotype, then we want to reduce the amount of class 2 elastics, so either used to go to less heavy elastics or just 12 or 16 hours a day. Yeah, it's a lot of intrusion, so I definitely would slow the intrusion down in lower arch to match amount of aligners in upper jaw. Slow movement of teeth in lower jaw to match amount of aligners in upper jaw. So what I would do is to do it more sequential. I would ask them to do delay retraction of upper lateral to lateral until canines have been retracted halfway. Yeah, there's one attachment that got changed by the software. Here I would rather have a horizontal. Yeah, I'm going to text them. Place a vertical rectangular attachment on upper right premolar. Good. Okay, that was it. So what I would expect is that the final outcome, the upper incisors will be more retro-inclined. The curve of SPE will not be leveled as here in the picture, as here in the simulation. So what we're going to keep for the refinement is more intrusion of lower incisors and more lingual root torque in upper incisors. But I tend not to do all those overcorrections and put it in one clinchic, because then it tends to get a little bit out of control and it's very likely to get aligner misfitting. So and we will going to work on the occlusion anyway, so I wouldn't expect this is just one set of aligners. We will have at least one or two refinements, so it's okay to keep some stuff for the next refinement. Hope this was helpful. Please ask me whatever you want to know if there's something I can clarify, and thanks for watching and see you again.